We'll be discussing antidepressants in this video. We'll start with the SSRIs, selective serotonin reuptake inhibitors. Citalopram, escitalopram, paroxetine, fluoxetine, fluvoxamine, and sertraline are some of the most common. They are first line for major depressive disorder. They take up to 6 weeks to work, so dosing should be increased as needed in 6-week intervals. For major depressive disorder, the drug should be continued for at least 1 to 3 years. Side effects include weight gain, decreased libido, anorgasmia, sexual anhedonia, or the inability to feel pleasure when having an orgasm, and prolonged ejaculation. Some men abuse SSRIs in order to increase sexual stamina. They may trigger manic episodes in bipolar patients. And due to serotonin in the enteric nervous system, they may cause nausea, vomiting, and diarrhea or constipation. Serotonin norepinephrine reuptake inhibitors, or SNRIs, include venlafaxine and desvenlafaxine, as well as duloxetine. Initiation of treatment follows a similar pattern to SSRIs. Side effect profile is similar, but generally milder or less likely. This class may cause hypertension. Bupropion is a norepinephrine dopamine reuptake inhibitor and a nicotinic receptor antagonist. It is useful in depressed patients who want to quit smoking, as it can be used for smoking cessation. It also may lead to weight loss rather than weight gain. Finally, it is less likely to have sexual side effects and may actually increase libido and increase likelihood of achieving orgasm. They decrease the seizure threshold and therefore should not be used in bulimic patients. Serotonin modulators include mirtazapine and trazodone. Vortioxetine is an SSRI and serotonin modulator that may be useful in patients with cognitive symptoms of depression. Mirtazapine is commonly used as an adjunct to other medications and may cause weight gain and increased appetite. Trazodone is a common sleep agent. It may cause priapism. Tricyclic antidepressants include imipramine, doxepin, and anything ending in triptyline, such as nortriptyline or amitriptyline. These are older medications with side effects, so they are more commonly prescribed for neuropathic pain and enuresis in children. These may cause altered mental status, especially in the elderly, arrhythmias due to prolonged QT intervals, and seizures. Monoamine oxidase inhibitors, or MAOIs, such as selegiline, hydrazine, and phenelzine, are the drugs that are associated with hypertensive crisis or serotonin syndrome if taken when consuming aged cheeses, cured meats, and wine due to the high levels of tyramine in these foods. Serotonin syndrome is also associated with the combination of an MAOI with metoclopramide, cocaine, amphetamines, St. John's wort, linazolid, opiates, tryptophan, and other antidepressants. Patients on MAOIs need to wear a band alerting EMS, as this affects dosing of drugs such as epinephrine. Speaking of serotonin syndrome normally has an abrupt onset, rapid resolution, and presents with altered mental status, rigidity and myoclonus, hyperreflexia, hyperthermia, tachycardia, hypertension, and mydriasis. It can be distinguished from neuroleptic malignant syndrome, which is seen in patients taking antipsychotics, because NMS lacks mydriasis and clonus. Thanks for watching. Please like, comment, share, subscribe, and hit the notification bell for more great videos. Remember, if you don't want to miss it, look below and click it. Check the description for more great study resources.